I'm talking to Richard Shaffer, who is an oncologist who treats Dupuytren and Ledderhose by using radiotherapy. Richard, can you tell me what the side effects are of using radiotherapy, specifically for Dupuytren and Ledderhose?
Absolutely. So each treatment will take around, let's say, 5 or 10 minutes per hand or per foot. And each treatment is entirely painless. So, during the treatment, you won't notice any side effects at all. So no pain, no heat, no light. You wouldn't even really know the machine was on. So it's a bit like having a scan, basically. So you continue working, driving, doing all the things that you normally do. But about 2 or 3 weeks after each week of treatment, you'll start to get some sort of common things like mild redness and soreness of the skin, a little bit like mild sunburn. Sometimes it goes a little bit dry. If that happens, just put some moisturizer on. For most people, that dryness will go, but about 20% of people have ongoing dryness in the long term. Sometimes people also say that the texture of the skin can be a bit different. So in other words, sometimes it goes a little bit rougher or a bit smoother. Sometimes the skin feels a little bit thicker or a bit thinner. And sometimes it can go a little bit pale with some blood vessels growing over it. All of those are fairly minor changes in most people. The other thing that's really important is that radiotherapy is used in very, very high doses to treat people with cancer. But there is also a very small risk of causing a type of skin cancer in the area that we actually treat. Now, this risk is very low. For a 50-year-old man, we normally quote around a 1 in 1,000 lifetime risk. The average time to actually get a cancer from radiotherapy is about 30 years. For the basal cell carcinoma, which is the most common type. This is a type that doesn't spread. However, if you're older, the risk would be low. So normally for, let's say, an over 60-year-old, I say the risk is so low that it's difficult really to give a figure. But of course, if you're in your 40s, 30s, or even 20s, then the risk will be higher, although it's difficult to say how much. Personally, I don't treat children, and I'd be very loath to treat someone in their teens. And I tend not to treat people in their 20s. But of course, these are all a matter of trying to work out, well, what are the advantages of treatment? What are the side effects or risks of treatment? In terms of what you actually need to do in terms of when you get side effects, one of the most important things really is to moisturize your skin. But you also need to avoid doing tasks that will feel a lot of friction on your skin and a lot of trauma to your skin. So for instance, if you're a builder and you're lifting very heavy weights, wear gloves or get someone else to do those things that are traumatizing your hands. Other things like going to the gym, again, you might want to stop doing the very, very heavy weightlifting in terms of putting friction on your hands. People who go sailing, who have ropes going through their hands, they may want to avoid that or protect their hands. Extreme heat and cold also should be avoided, although again, normally like washing up, that sort of thing, fine. And also using very sort of toxic chemicals. If you can't avoid it, again, you should avoid it during this time.
One of the questions we tend to get is, can I go swimming, thinking about bleach in the water in a swimming pool?
So generally we say, whilst the skin is very red and dry, it may well be worth avoiding chlorinated swimming pools. However, after that time, once it doesn't feel sore anymore, it's reasonable to do that again.
Great. Thank you very much.
Pleasure.